Hello guys, today we're going to talk about management of care for patients dealing with infectious diseases. Here are your objectives for this lesson and what you should be able to do by the end of the PowerPoint. So we're going to look a little bit briefly at the pathophysiology of infectious disease, or how a body's defense mechanisms work to prevent infection, how infection comes into our bodies, and then what that response is for our bodies to kind of get rid of that pathogen, bacteria, virus, whatever it is. So first of all, infection is from an invasion of the host tissues. This is by a microorganism, oftentimes a bacteria, virus, a parasite, some sort of microorganism enters in through the body. Now we're going to talk about the chain of infection, how it enters in, what that portal of entry looks like. But for the most part, our body has different defense mechanisms to prevent infection. Otherwise, we would be sick all the time. We'd be like just a little walking bag of disease. So our body's defenses that we for sure know about, we've talked about our skin, right? Our skin is the largest organ of the body. It helps to prevent infection, helps to provide a barrier to what we see out in the world, right? If our skin has breakdown, that's that portal of entry where that bacteria, that virus, that microorganism can come in and cause disease. Our mucous membranes, we talked a little bit about that in respiratory, right? Our mucous membranes help to prevent infection through filtering our air, filtering what we breathe. It also helps prevent infection through the buildup of mucus. So that mucus traps bacteria, traps infection from entering into our body. So it helps keep a lot of it out. And then our immune system, we talked a little bit about that and how the immune system, brings the parts of our body like white blood cells, phagocytes, neutrophils, brings that to site of infection to help fight off those microorganisms that enter into the body. It also helps to build immunity through the creation of antibodies, so that in the future, if we come across this bacteria or this virus, our body creates those antibodies so that we're able to be more effective in fighting that off. Our inflammatory system also brings that local response to a site of injury or infection. So that's why you will have redness, you'll have swelling, you'll have inflammation, and you'll have a fever oftentimes with infection or injury, because that system brings all of those things to that site of infection so that the phagocytes can eat up dead tissue, eat up those decaying cells. We can have the neutrophils come in and fight off infection. White blood cells come in and help to repair and fight off infection as well. So that's part of that inflammatory process that we talked about earlier with musculoskeletal and our immune response. So again, that systemic response, the fever that we get when we're sick, helps to kill off bacteria. That's why we have a high fever when we get sick. Malaise is the systematic response that our body does to help our body repair. Our metabolism is overproductive, brings all of those red blood cells, white blood cells, immunity related response to the site. And so that's why we get sick, we get tired. And then our elevated WBC count, again, neutrophils, eosinophils, those types of things will go to the site of infection or injury to help repair, help build immunity for future responses. So if you're not familiar with the pathophysiology of those specific responses, go back and revisit that, especially in the textbook. They should have like an overview of that, but that's covered a lot in microbiology and A&P for your review. So we're going to look a little bit about the chain of infection. So the chain of infection describes how infectious diseases spread from one host to another, so meaning one person to another. It has 6 different parts to be aware of, and infection occurs if all 6 of those chains or links are present. Nurses have a direct impact on infection because we can break any link of those chains and transmission is stopped. So it's really helpful in looking at infectious disease prevention, keeping numbers down, especially with healthcare acquired infections and things like that. Nurses are directly responsible for this. And so oftentimes we can tie our nursing interventions to the why. Why are we doing this to prevent infection? And so be aware of that when you're looking at how you can prevent infection in the hospital. Be aware of where you can impact it in the link or in the chain of infection, which link you can remove. So the 6 links of infection or the chain of infection has to do with the infectious agent. So that is the pathogen or microorganism that causes that disease. These things could be like bacteria, for example, MRSA, viruses like the influenza virus, funguses or fungi, or parasites. How that nurse breaks that specific infectious agent chain is through good hand hygiene, making sure equipment is cleaned or sterilized, and using antibiotics and antiviral medications appropriately. The second link is the reservoir. So this is where the pathogen lives and how they multiply. So oftentimes a reservoir can be found in, humans, food, medical equipment. Maybe it's a fungus in the soil or the water. And so the way the nurse breaks this chain is again through cleaning, making sure we have a clean environment, wiping down surfaces, using sterile technique, or using proper waste for things like food, medical equipment, and things like that. The third link is the portal of exit. So this is how the organism leaves the reservoir. So this is through, kind of how it's a little bit of how it can be transmitted. So maybe the organism leaves the original host and it exits through that host through things like respiratory secretions, blood, urine, feces, maybe through a wound. So the way we can prevent a portal of exit happening is through proper coughing etiquette, covering your mouth so that that microorganism's not exiting out and spreading through the air. Use of PPE, so masks and gloves, or covering wounds if they have secretions or things that are leaving the body. Your fourth chain is mode of transmission. So this is how the pathogen travels to the next host. So we want to break that transmission so that we don't spread that infection. But we travel, or the pathogen travels. We transmit that infection through contact, droplet, airborne, or vector transport or transmission. So our contact diseases, for example, would be things like C. diff or MRSA. That's through one individual touching a surface, that bacteria or virus is on that surface, the next person comes in and touches that surface again. So it's through the contact. So again, breaking that transmission would be use of hand hygiene and gloves. When we look at droplet, an example of that would be influenza virus. So that's spread through coughing, talking, kind of being in close proximity with another person that's infected. So we can cause that to not be transmitted through use of masks and PPE to make sure that we don't get that droplet into our mucous membranes. Airborne is another transmission. That's, for example, like TB. That is a smaller molecule spread throughout the air. So the way we can break that transmission is use of proper PPE, like the N95 masks, the hoods, reverse isolation or negative isolation pressure. And then for most of our pathogens that are of a parasite or parasitic infection, that would be through vector, which is a mosquito or an animal bite, something like that can be transmitted. So that would be bloodborne illnesses like West Nile virus is a vector spread infection. So again, we can do things like environmental manipulation, making sure that we use, mosquito spray that contains DEET, mosquito nets, and things like that. Now sometimes we don't see infections very highly in certain areas of the world. So, we don't see a whole lot of West Nile virus here. It does happen. It is present in the United States, but it's more prevalent in certain areas of the world versus, maybe we have a high case of valley fever here in Arizona because it's in our soil, it's in the dirt, and so they may not see it in other areas of the United States. We had a patient from Hawaii who they weren't really familiar with West Nile virus, so that patient didn't know they had that. They didn't catch that quickly. Um, so that's the mode of transmission chain. Then we have portal of entry. So this is the way the pathogen enters a new host. So that's going to be, again, as I said, a break in the skin, mucous membranes, respiratory tract. We breathe it in, we touch it, it enters into our mucous membrane, or breaks in the skin, and also can be through urinary tract. So the way we break this as nurses, we use aseptic technique, keep our hands clean for decreasing that contact transmission, good catheter care, making sure our patients have, decrease in bacteria there, good wound care, standard precautions, making sure we wear gloves and things like that, and then use of PPE. And then 6 is a susceptible host. So this is where a patient or a person is at risk for an infection. These oftentimes are more higher risk. Patients that get infections are higher risk if they are immunocompromised. So their immune system's not working properly. It's not able to fight off those infections. Maybe the elderly patients, they're a little bit more immunocompromised. We'll see higher risk of infection in them. Surgical patients, patients with diabetes. So anybody that has a disease process that's really dampened down their immune system, caused break-in skin, causing problems with their respiratory system or their mucous membranes. So, really anybody is susceptible, but really we have people that are at higher risk for that infection. So the way we can help prevent infection in those people are through correct immunizations, recommending that they're up to date on their vaccines, they have good nutrition, they get plenty of rest, good hydration, keeping hydrated, making sure that they're educated on hand washing, preventing infection, and, keeping their areas clean. So when we are providing care to patients that have not been diagnosed with some sort of a transmittable disease, so maybe your patient has not been diagnosed with TB or influenza or anything like that. Maybe they've just come into the ER, they're just being assessed. We really want to use standard precautions on our patients. So standard precautions are precautions we use for every single patient, regardless of what they come into the hospital for, regardless of what they're being treated for. It helps to just prevent exposure to ourselves, keeps us safe and healthy, and it keeps us keeps transmission down. So we don't want to spread things to other people, especially if we don't know somebody has something, right? Maybe you just got a light cough and you're like, oh, I just feel a little under the weather. Maybe you don't know that you have influenza or COVID right away. So we really want to do just kind of basic standard precautions. So we use these with all patients regardless of their diagnosis. And what those standard precautions are hand hygiene. We want to do hand hygiene before and after contact, anytime we're dealing with body fluids, before and after we go to the bathroom, before and after we eat, those types of things, just to really keep hand hygiene at the top of our list of how we prevent disease and illness. Now, that's one thing you're going to see out in the hospital and in the healthcare field. They harp on. They're like, wash your hands, wash your hands, wash your hands, or use the hand sanitizer. There are some times when hand sanitizer can be used, and sometimes it can't. Sometimes you have to do actual soap and water hand hygiene, and we'll talk about that in a little bit. But hand hygiene is always number one for decreasing transmission of infection. Now we use gloves, so the use of gloves kind of is a little bit more standard than it used to be back in the day. Back in the day, nurses would come in, they'd change briefs, they'd clean patients up, they wouldn't really use gloves. But about the time that we started to really use gloves with most contact was in the 80s, 90s, AIDS um, endemic, pandemic. That's when they started really pushing that for most exposure to patients. Now, is it okay to go in and, you know, check your patient's vitals without gloves? Yes, that's okay. As long as your hands are not, open, you don't have open wounds on your hands, your patient doesn't have any diagnosed infections or anything like that. It's okay to go in, touch your patient, and go out, just making sure that you're sanitizing or washing your hands before, sanitizing and washing your hands after. We still need to have therapeutic touch that's incorporated in our patient care. But the use of gloves and PPE is required if an exposure is likely to any type of body fluids, meaning pee, urine or feces, secretions, wound secretions, anything like that, then you probably would want to go ahead and use gloves and gowns. If you're providing any personal care to your patient, you'll want to make sure to use that PPE. And then making sure that we do safe handling of sharps. So never ever recap your needles. If your needle has a safety on it, utilize that safety in a correct way. And I know a lot of you guys know that. I've seen you guys in open lab using those safety mechanisms. You also want to make sure to put the sharps directly into the sharps container if there is no safety. Don't do any recapping. Don't even do the little swoop method that you are taught in lab with a clean needle. Don't do that. Just throw it directly in the sharps. That's okay. And really educating our patients how to do it too. Some patients are sent home getting injections or poking themselves, with insulin, and they may not know how to handle sharps. They may not know where to dispose of that at home. So really educating our patients on that too, so that they stay safe and they don't expose anybody to something that can be transmitted. So one way they can do it is disposing of needles at home. They could put it in a milk jug with a cap on it, and that's puncture proof. And then that can just go directly into the garbage. They can find, hospitals or pharmacies that are willing to dispose of needles, but for the most part, they just throw them right in the trash can once they've put them in a puncture proof container, and that should be fine. So you all probably know this from fundamentals. I think they pretty much teach you all of this, what level of contact isolation, droplet isolation, what level of precautions you're required to use and for what, diagnosis. But we'll just touch base on it again. So contact, remember, contact is exposure through touching surfaces that might be infected with a microorganism, and then entering that into your mucous membrane or through an opening in the skin. So for example, if my patient has C. diff, maybe when I'm changing their brief, I'm wearing all my PPE, my gown and my gloves, but that patient could be digging around in their brief and maybe they're touching bed rails and you come in and touch the bed rail, not seeing any poop, but that C. diff is still there. Then you go out into the hallway and maybe touch the phone to call a doctor or something like that. That's how that pathogen is spread. So for patients who are on contact isolation, the recommended PPE is to wear a gown and a glove. This helps to prevent spread throughout multiple people. Now with our C. diff, that is a special contact isolation. And the reason that's special is because the spores of C. diff will not come off of your skin with the use of alcohol-based hand sanitizers. So you really need to do hand washing with soap and water for that C. diff. So that's what we call an enhanced contact isolation. So gown and glove, dispose of all of that, doff that off inside the room, and then wash your hands at the sink with soap and water every single contact. Again, the alcohol sanitizer does not get rid of C. diff spores. When we're looking at droplet precautions, you must wear a surgical mask, and then you probably will wear a gown and glove as well, especially if you're doing any procedures or anything where that patient would talk or cough. Maybe you're doing suctioning and they're going to cough a ton. Then you really want to wear that PPE because those larger molecules spread throughout the air. Now, with droplet precautions, that's within a 3 feet zone around the patient. So once you're kind of further than 3 feet, usually those droplets do not get to you. They kind of go out into the air and fall onto the floor. So just making sure that you wear a glove and gown and then that surgical mask. And that surgical mask should have eye protection as well because you're wanting to protect the mucous membranes so that you're not getting the infection that they have. For example, the influenza virus, okay, that's how it's spread, is close contact with droplets. That's why we see a higher case of influenza in the wintertime, is because usually we're inside, we're not outside as much. I mean, in Arizona here, yeah, for sure, we're outside, right? That's when we're highest. But we tend to be like in groups more in the winter, especially in cold climates. That's why you're inside more because it's cold, it's snowing outside, and so you're in groups, you're in close proximity with each other, and so that transmission is just higher. So that's why you'll see your influenza rates increase. And then we have our airborne isolation. So this is for those smaller molecule infections. things like TB, measles, and varicella. That's spread through airborne. Um, for this, you'll want to wear a special respirator. It's called an N95 respirator. This helps to filter out the smaller molecules and protects the individual with the mask on. You'll want to use a negative isolation pressure room that gets the, infectious material, blows it out of the hospital or the facility, and just keeping that patient isolated. We talked a lot about this in respiratory. So we talked about, what are some of the, things you do with your patient if they are on airborne isolation and they need to go down for a CT or an MRI. You've got to have them just wear a regular surgical mask. But when you go into the patient, if they don't have a surgical mask on, they've not been wearing surgical mask, you'll want to do that N95 respirator because the molecules are out of the body and then they're suspended in the air. They're kind of floating in the air because they're that smaller molecule. So just really protect yourself. So these are the transmission-based precautions, some of the isolation that you should use, and then some of those, an example of some of those infections that are for each one of these: contact, droplet, and airborne. Okay, so now we're going to talk about healthcare acquired infections, or they used to be called nosocomial infections. You might see that word. But for now, they're called healthcare acquired or healthcare associated infections, HAIs. Why do we care about these? Well, we care about these because we've created an infection in our patient that could have been prevented. And a lot of times, these infections cost healthcare and the hospital system or healthcare system millions of dollars. So that's why it's so expensive, right, to be in the hospital, is because we have to offset that cost. So an HAI is a healthcare acquired infection, and this is an infection that develops either while they're in the hospital or after they've been in the hospital or a treatment facility. This was not present or in the incubation period when they were admitted, and usually appears either about 48 hours after admission or can be all the way up to 30 days after a procedure, so like a surgery or something like that. So these can occur in any settings where we do any type of procedures or healthcare is provided. It can occur like in hospitals, our outpatient clinics, long-term care facilities are really big for them, and even home health. So, people coming into our house giving us care can cause a healthcare acquired infection. So again, they're completely preventable. Nursing care has a huge impact on preventing these, but they are one of the leading causes of death in our patients and one of the biggest costs of increased rising costs in healthcare. They usually will add length of stay to your patient's hospital stay. So if a patient gets a healthcare acquired infection, they are shown to be in the hospital for a week to 2 weeks longer than if they didn't get the infection. They can increase the use of antibiotic use, which leads to antibiotic resistance, and they can cost billions of dollars in annual costs for a healthcare or a hospital system. Um, they also look at healthcare acquired infections if facilities are getting them. They also use that as an indicator of the quality of care for that facility. And hospital facilities can actually lose reimbursement from Medicare and Medicaid if they have a high level of healthcare acquired infections. So it's really important to pay attention to them and decrease them, not only because they kill patients, but because they cost a lot of money. And if you think about that, that's why you're not going to get adequate staffing, right? I mean, among other things. But, if the hospital has to pay out $1 billion for people getting sick while they're in the hospital facility, they don't have money to put back into the facility for equipment and staffing and bonuses or raises and things like that. So that's, really important to look at. So a lot of the common types of healthcare acquired infections that you'll see are going to be CAUTI, so they call it CAUTI. It's catheter-associated urinary tract infection, CLABSI, which is central line associated bloodstream infection, ventilator-associated pneumonia, which is that VAP we talked about with respiratory, SSI, which is a surgical site infection, CDI, which is C. diff infection, and then those are usually your common ones. And those are the ones we have. Oh, VRE, which is vancomycin resistant like it's like a vancomycin resistant infection. So with our HAIs, it's usually spread through the same chain of infection that we talked about. So those six, the 6 steps. And again, nurses are crucial in breaking that chain, so preventing healthcare acquired infections. So our number one way that we can prevent HAIs, I'm going to stumble on that every time, is hand hygiene. So this is the most effective method to prevent that transmission. With C. diff, you got to use soap and water. Other than that, we can use alcohol-based hand sanitizer between our patient contacts. So again, in between rooms, when we enter and exit the room, we should be hand sanitizing. If we see visible soiled hands, we definitely want to do soap and water versus the alcohol wipes or alcohol Good grief. The alcohol sanitizer. Sanitizer is the word I was looking for. So just making sure we do good hand hygiene. Doing those standard precautions, so assuming all body fluids could be potentially infectious and making sure to wear gloves and doing proper disposal of our PPE and then proper disposal of sharps as well. Understanding the transmission-based precautions, so understanding how that transmission occurs so that we can wear proper PPE will also help decrease HAIs. We want to make sure to look at device management. So if our patient has a catheter or IVs or central lines, ventilators, we want to make sure that we remove those as soon as possible and making sure that we do really good cleaning on that. So good catheter care, making sure our ventilators, we do ventilator pneumonia prevention, so oral care twice a shift, use of incentive spirometer on our patients to prevent pneumonia, those kinds of things. And we really need to do assessments on those sites of insertion, looking for any redness, swelling, or drainage signs of possible infection. We want to do good environmental cleaning, so making sure that we disinfect those high touch surfaces like bed rails, IV pumps, monitors, doorknobs, door handles, those types of things. And you'll see that. I know most of you guys probably see that in Mayo because they want you guys to wipe down surfaces twice a shift and they audit that and everything. That's because we're, seeing a higher case of healthcare acquired infections, and so we don't want our patients to be sick. So really utilizing bleach wipes, or we call them cavi wipes. They're like a disinfectant, a wipe to really wipe down those high touch surfaces. And then making sure we use appropriate disinfectant. So again, that C. diff is a special one. We have to use bleach for C. diff because the normal cavi wipes or normal disinfectants do not get rid of those spores. So C. diff, you have to wash your hands with soap and water, and you can only use bleach to clean the surfaces to get rid of those spores. So making sure that we understand for that little special C. diff there. And then good antibiotic stewardship. So we talked about that a little bit, but using antibiotics only when they're needed, only making sure that we use them for the length of the infection, making sure that they take the antibiotics for the full course, not stopping it early just because they feel better, because that will cause that antibiotic or that will cause the bacteria or the virus to come back to multiply, if we're not taking the full dose of their antibiotics and their antiviral medications as prescribed. And then we want to prevent that multi-drug resistant organisms or MDROs. If we're taking antibiotics when not appropriate, so maybe we come in, our patients come in and they're like, oh, I've had a runny nose, I'm sick, I have a little bit of a fever. If the doctor just prescribes an antibiotic for them, without testing to see if it is a bacterial infection, they may be giving an antibiotic when not needed. And so the body will then become resistant to that type of bacteria when it really is necessary. So that's why we see a lot of times, providers will not write for antibiotics initially until they get those samples sent and they're checking, is it a bacteria in the blood or is it a virus in the blood? Is it a parasitic infection or something like that? So that's how we do really good antibiotic stewardship. So just making sure that, we do hand hygiene, do proper PPE and isolation, making sure that we clean our lines, we're doing really good catheter care, central line care. If the patient doesn't need the line, get it out immediately. Don't use lines if not necessary. So don't put in a Foley catheter just because it's convenient for the nurse to not have to get the patient up. Only use it if it's absolutely necessary. Wiping down surfaces, keeping that environment clean, decreasing the use of antibiotics when not needed. and just really educating our patients on how to prevent infection while they're in the hospital. Okay, so I think we talked a lot about this already, but I'm gonna put another slide in here specifically for C. diff. C. diff is an infection of the GI tract. It causes excessive diarrhea for our patients, and that is transmitted through contact. So again, our patient might be having excessive diarrhea. Maybe you changed their brief, used your gloves and everything, you did what you were supposed to, but that a little bit of that, poop got on your skin, you didn't realize it, you go out instead of washing at the sink with soap and water, you decided to use the hand sanitizer because you forgot. You go answer the phone, talk to the doctor, put the phone down. The next person comes, touches the phone. Maybe they go to lunch without washing their hands. They're eating their burger. And now that person just had a transmission of C. diff. So they now have C. diff. So for C. diff, again, it's caused by a spore forming bacteria. And those spores are pretty tough. They stay on the skin and they stay on surfaces for long periods of time. So we really want to use soap and water, not alcohol scrub for the hand hygiene. So soap and water every single time. And then using bleach-based disinfectants. We want to do contact isolation when we go into the room, don before we go in the room, doff the PPE before we leave the room, and then just making sure that we do good focus on infection prevention for C. diff. It's easily transmitted, so that's why that's one of the big ones in healthcare that we focus on. So we have infections that are around for long periods of time, right? We've probably all heard of C. diff and we've heard of the influenza or flu. These are pretty common. We hear about them, we know how to prevent them, we see them frequently. Sometimes we have diseases where they come out of nowhere, right? And they're emerging diseases. They're new. We haven't learned a lot about them. We don't see them frequently. We're not, really familiar with them. So just making sure that we really understand how to assess our patients, how to look at could this be an infectious disease and report that to the proper agencies. Now, we have all probably been around now with the COVID-19 pandemic. This was new. We didn't really have any idea about this infection. We didn't know how it was being spread, how to prevent it. So, just reporting it to the proper agency is saying, hey, this is something new. I haven't really seen it. Involving those infectious disease doctors, those providers. We have infectious disease nurses where that is their sole focus is how to prevent diseases, how to stop transmission from occurring, making sure that the hospital's clean and things like that. But when you assess your patient, a lot of the things we want to find out is, do they have any signs and symptoms of an illness, right? Cough, uh, discharge? Are they coughing up any sputum? Do they have any weight loss or like fevers or any unexplained symptoms of illness? Making sure that they don't have, a viral infection or a bacterial infection. And then one other thing to ask is, have they traveled recently? Have they gone outside of the country or traveled internationally? Because a lot of those diseases, we don't really see often in the United States. They can come into contact with that. So like, for example, Ebola, maybe they traveled outside of the country to a place that has higher cases of Ebola. They got infected with it, they've come home, and now we're seeing that in the United States. And some of these are more easily transmitted, and we don't have immunity to them, and so we're at higher risk of developing these diseases. So again, making sure we're vaccinated on what we have vaccines for, kind of educating your patient, trying to encourage them to take vaccines, report any illnesses or cues of a patient illness, and then getting your providers involved, those infectious disease nurses or providers involved to see, is this something that's going on that could be an infectious disease? Okay, so we did previously talk about HIV, but HIV goes in this lecture as well because it is an infectious disease, so it can be transmitted from person to person. So just remember, just kind of the basics of HIV. So the virus enters into a host through contact with infected body fluids, usually through sexual intercourse, needle sharing, or drug use. breast milk. It can occur through pregnancy as well. So it can be spread to the fetus in utero. But understanding that the HIV virus has to be in a host. So that individual, it has to live inside of a body. Um, it does not live on surfaces, so you can't get HIV from elevator buttons or toilet seats. You can't really get it from kissing or hugging, those types of things, unless the individual, you have a gaping wound on your mouth, they have a gaping wound on their mouth that has a bunch of blood, yes, it can be contracted that way, but it's very, very, very low, almost untraceable. So they say you cannot get it from kissing, can't get it from hugging, toilet seats, elevator buttons, those types of things. It is potentially found in blood transfusions, but with all of the screening that we do with blood transfusions now, HIV is very, very low risk. So it's like 0.001% or something like that. So they don't even list that as a potential for blood transfusions. But again, it's transmitted via blood, sexual contact, or perinatal exposure. We can prevent it. So HIV is completely preventable. We can do things like safe sex practices, utilizing condoms, abstinence, those types of things, getting tested frequently, needle precautions. So that's a big one for healthcare providers, making sure that if you poke yourself, you get treatment right away, get your testing done, take your PEP or your PrEP, especially if you have a high risk patient or population, or if your patient's HIV positive. That happens sometimes where we have an HIV positive patient, we have an exposure, you have to take that PEP or that PrEP medication to decrease your risk of contracting HIV. So just making sure that you seek out care, get help if you have an exposure rate. So let's see, what else do I have on here? So kind of have an idea of the overview, but for the most part, this is a viral infection. And so what occurs once that virus enters into that bloodstream, the HIV binds to those CD4 receptors on the T4, the T helper cells. And so it causes that virus to use that reverse transcriptase, changes the RNA into DNA. So that virus is able to multiply and change our DNA's kind of nucleus. And so it starts to make replications of itself. So it replicates and creates little clones essentially. And so once it starts replicating and creates this like clone army, then it infects more T4 cells and it kind of replicates and increases. Um, so for our HIV, what we look at is kind of the level of HIV infection. So usually about 2 to 4 weeks after exposure, this is kind of stage one. This is where flu-like symptoms can appear for the patient. They usually will have a high viral load count, and we call that a CD4 count. So that high viral load or CD4 will be greater than about 500. This is when we find it to be the most contagious because usually people mistake it for a viral illness. So they're not taking those precautions, they're not preventing exposure because they just assume they're a little bit sick. Now, during that latency period, stage two, this is where those viruses produce at low levels and the patient might become asymptomatic for years. So their CD4 count drops a little bit, but they do have that gradual decline in their immune function. Now, when we have stage three, this is where we define them or diagnose them as having AIDS. And this is usually where they have a presence of some sort of secondary illness. So pneumonia, TB, Kaposi sarcoma, they'll find those secondary opportunistic infections. Their CD4 count is less than 200. So this is where that severe immunosuppression occurs. Okay, so I just added a couple questions for you just to check your knowledge here at this point. So see what you think. Okay, so the correct answer for this question is A. Anytime somebody has a suspected disease process that requires isolation, you want to make sure to put them in isolation first, and then you can provide any treatment that's necessary. With TB, it is airborne precautions are required for that negative pressure room and use of an N95 respirator. Droplet precautions are not correct for a TB isolation. That would be more appropriate for something like influenza. C and D are not appropriate because one, you don't know if there is a confirmed TB diagnosis, which would require medications, and antiviral medications are not appropriate without confirmation of diagnosis. So your best answer is A. See what you think here for this select all that apply. So for this one, your correct answers are B, C, and D. Remember, C. diff is that special contact precaution. This requires hand washing with soap and water, not alcohol sanitizer, as it doesn't remove those spores completely. You'll also want to utilize bleach to disinfect. So those sanitizing wipes are not appropriate. Bleach wipes are the only appropriate cleansing wipe or disinfectant. And then droplet precautions are not necessary. Contact isolation is appropriate for C. diff infections.